Hello, and welcome to this running analysis. In today's video, we will analyze a runner who presents with a hip drop. We will examine how that can influence his running technique. Meet Corey. He's 30 years old and has been running since 2018. Currently, he runs 35 to 45 miles per week. He has a history of shin splints, runner's knee, Achilles bursitis, and plantar fasciitis. His goal is to win a marathon. Let's take a look at Corey's hip alignment when standing on one leg. This is the angle of hip drop. The normal angle is usually around 10 degrees. Higher angles were found to correlate with hip injuries, knee injuries, and ankle pain. Here we notice that the left hip is dropped to 7 degrees, which is an acceptable amount. Now let's take a look at his right hip. It is 13 degrees from the horizontal, which is almost double of the opposite side. Let's take a look at a reason why his hip might be dropping. Whenever standing on one leg, the alignment of the hip is controlled primarily by the gluteus medius. This muscle allows the hip to slightly drop during running, and when necessary, bring it back to the level. This muscle is not only responsible for the amount of hip drop, but it's also responsible for the amount of rotation at the hip. Meaning, when a weakness is noted, the runner will lose control in multiple movements, which eventually can reflect on the knee, the foot, and the lower back mechanics. Weakness of this muscle has been correlated with the iliotibial band syndrome and patellofemoral pain. Corey was prescribed a number of exercises that would target the weakness of the hip muscles and keep the pelvis aligned. We will check back with him in a month to make sure he's progressing well. Thank you for watching.